Hey everybody, my name is Caleb Wynn, and today I'm going to be presenting on communicating effectively during conflict as a healthcare manager, supervisor, or administrator. I am at the University of Emory. I'm a student there, and I am in the medical imaging department in the bachelor degree program, and I'm doing the administration track. So let's get started. I have a video that I want to show you that it just exemplifies, and it's just a situation that could arise in healthcare. I'm sure you've either seen or heard, a similar situation or whatnot. But here is the video.
Excuse me, are you Molly Brown?
Yes, I am.
Hi, I'm Dr. Green. I'm the attending. I haven't actually met you, but I need to talk to you if that's okay with you.
Well, I'm just in the middle of my coffee break right now, so if it could wait, that would be great.
You know what? I just got paged. I've got to go down to the ER, something I've got to deal with right away. I'm going to be straight with you. I've had a complaint about you.
I'm sorry.
Yeah. One of the patients down the hall reported that he heard some, what he thought was abusive behavior happening to Mr. Jones in 4A, so I need to talk to you.
I'm sorry, Mr. Jones complained?
Yeah.
Complained about me?
No, it was another patient who heard something going on. I just want to check this out with you because I have to find out what actually happened.
Have you met Mr. Jones by any chance?
Actually, I have met Mr. Jones, yes.
So, who was the patient then that complained?
You know what, I'm not going to tell you that. I just need to check with you what happened this morning. Can you tell me in your own words what happened?
Well, like I said, I was just trying to get Mr. Jones prepared for you guys to come around for grand rounds.
Right.
And well, if you've met Mr. Jones, you'd have a pretty good idea what I was up to.
Yeah, I know.
So, have you seen him?
I'll give you, Mr. Jones is difficult.
Yes,
What
he is.
happened?
Like
What
I-
went down?
I was just trying to get him cleaned up of all the, the urine that was all over him, the vomit, everything else that was going on. And that's really it.
Yeah.
Look, I don't know what the problem is here, so.
Well, what I've been told is that this patient heard some verbal abuse and he thought he heard a slap. But is that the truth? Is that what happened? Did you actually do something to this patient?
I'm sorry, you're coming in here accusing me of abusing somebody when you haven't even, you're taking
this by another patient.
I'm
And
sorry.
you know all these patients on this ward are my responsibility. I have to check this out and I really want to find out what's happening. But I thought I'd do you a favor and talk to you before I talk to your supervisor. But that's what I'm going to have to do if you're not going to tell me what happened.
Well, thank you very much for the favor. I appreciate that.
Okay.
But I'm afraid that, all I was trying to do was get him cleaned. Look, I don't think you appreciate what kind of patient this man is.
Look,
he's just
he's
I'm sorry, excuse me. Do you mind if I finish?
Actually, you know what? I just need to hear in your own words. Did you slap this patient? Were you abusive to him? Verbally? Did you swear at him? Is that what happened?
Can I talk now?
I'd really like to hear what you have to say.
Okay. So like I said, all I was trying to do was get him cleaned up. I can't,
Some of these patients are difficult, but we are not expecting them to be perfect when we walk through the door.
can't believe it.
Look, what happened? Do I need to report this? And what's going on here? Because if that patient is in danger because of the care of one of the personnel here, that is my responsibility and I have to report that, so I have to find that out.
I am trying to tell you what happened. But obviously you're not very interested in hearing my side of the story, are you?
I am interested, and I think you should just calm down because I need to get the facts before I report this. And you're obviously not in a great space, so let's find out what really happened.
Alrighty, so that was a pretty crazy example of conflict. As you can see, during that example, tone wasn't used very well. Words weren't chosen very wisely. Body language was not very good either. So let's see why that video is still playing.
What?
Okay. So as a little intro to what I'm going to be talking about today, what is conflict? What does conflict mean to you? Just think about that right now. What does it mean to you? What examples have you seen? How have you dealt with it in the past? And then we're also going to talk about the conflict in healthcare. That maybe I know some of you have worked in healthcare, or each one of you has definitely been to the hospital or doctor's office at some point. So where do we see conflict specifically in healthcare? What departments, what floors, what people are involved with it? The effects of conflict. So we all have seen negative conflict. We've all have seen conflict turn out in a bad way. I'm sure that you can think of an example in your past where you've gone through some pretty rough conflict, whether it be through healthcare or just any facet of life. So we're going to talk about that. We're going to talk about what is effective communication. What's it mean on paper? What does it mean in terms of actions, in terms of how you treat your employees, how you treat your subordinates and the people above you? Just what is effective communication? How does it affect conflict? So how do you think that effective communication will affect conflict? So that could be rhetorical or a response. So how do y'all think that effective communication affects conflict? Anybody?
If you communicate effectively, you would at least minimize it.
Right. You give yourself the best chances to deal with that conflict or to receive a positive result from that conflict.
Or de-escalate it.
Right, exactly. So how can we develop this? If communication is something that can help with conflict, how can we develop it? We're also going to talk about that. And then personal examples of myself. And I'll also give each of you the opportunity to talk about examples of conflict in your life, whether it be at work, school, and personal life, if you want to. So let's get started with everything else. So, like I said, what is conflict? So conflict is the internal or external discard that results in differences in ideas, values, or feelings between two or more people in a way that one tries to prohibit another from achieving his or her goals. So they're opposing forces. They're two people who are striving for a goal, but they're opposite goals. And what works for one person works against the other, and vice versa. So Moses Degrad and Majbafen kind of gave that example or definition of conflict in their article in 2019. But they also say that conflict, them along with almost every other paper that I've read about conflict or effective communication, is that it's inevitable. Everyone at some point in their life is going to face conflict, and everyone in an organization is going to face conflict. So when people there's always going to be opposing sides in an organization, especially in healthcare. And it's also more often with upper management. You think about managers, supervisors, administrators. They're over a certain group of people, and they're responsible for those people, and they have to deal with each conflict that arises in their department. So it could arise more often with managers and supervisors and people like that. So types of conflict in healthcare. These can be outside of healthcare as well, but we talk about interpersonal conflict between two or more people. So that could be conflict between yourself and another individual, or it could be conflict between yourself and a group of people. Say you were a nurse on the floor. You could be doing your thing, you're working by yourself, and you're kind of new, and everybody else there is kind of working against you, or you're not doing things quite the way that they like to do things that they're used to. So therefore, there's a little bit of conflict between you and the floor in that scenario. So intergroup conflict, that is within one group of people. We'll get to other examples in a minute. And then intergroup conflict is between two or more groups of people. I can't remember if I said intergroup or intragroup. So I'm just going to clarify intragroup and intergroup conflict. Very different. All right. So now we're going to talk about where do we see conflict in healthcare. So one way or another, among the staff and among the patient and family, that can be seen as almost anybody in a hospital. Just about anybody. So for staff, it can be interpersonal, intergroup, or intergroup, and then among patient and family, it can also be all three as well. So some examples of interpersonal conflict: a manager and subordinate, or multiple subordinates. Maybe the manager is having a problem with some people showing up late to work, or maybe he's having a problem with a lackadaisical work ethic, or something of that nature. Patient or family member with floor staff. So this is often a common conflict in healthcare because there's just a disconnect, or there can be a disconnect between the patient and the family. The patient and the family could be also considered an interpersonal example of conflict, and then with the patient and the floor staff as well. So a doctor and technologist, that could also be seen as interpersonal, and then a nurse and multiple nurses of a different floor. So maybe you're trying to transport your patient as a nurse, he needs to go to CVICU, but the other floor was not being very receptive, or they're just not cooperating in the way that they should, or that at least that you think they should. So those are some examples of interpersonal conflict. And then we have intragroup conflict examples. Nurses on the same floor. This is within a group of people. Intragroup is within a group. So you've got nurses on the same floor, technologists in the same department. Maybe they're fighting over what technique is the right to use, or whether or not post-collimating anatomy off of the final image is okay or not, which it's not okay, but that's a whole nother story. Doctors of the same group. Maybe two doctors are caring for the same patient, or at least trying to care for the same patient of the same group, and they don't really agree on what the other doctor has planned for that patient. That's also another common conflict that comes up. And then family members. Patient can be involved with that as well, but really the patient is in their own category. So family members oftentimes can cause many conflicts at the hospital, because maybe they just have fighting, they're not in unison. They like I said, there's opposing factors to what they want done. Some of them may want their 102-year-old grandpa to live as long as he can and everything have done, but maybe the other half is saying he's lived a good life, or it's time to let go. There's no way to really know what the situation is until you're in it. But family members, there is some conflict with family members as well. So intergroup examples, nurses on different floors. So maybe a group of nurses, maybe Heart Tower 4 and CVICU are always at each other's throats. They can never effectively or efficiently get patients transported to the CVICU because something that CVICU is doing or something that Heart Tower 4 is doing is just not clicking together. It's not meshing well. Imaging professionals of different modalities. Maybe you get to a patient's room and you think that he should get a chest x-ray before he gets a head CT. And so does the CT technologist. They think they should get a head CT before a chest x-ray. Maybe you get there at the same time and there's some conflict with that. Doctors of different groups or of a different group caring for the same patient. So we talked about doctors of the same group. What about doctors of different groups? Maybe a patient has doctors who have been consulted from vascular, from cardiology, from nephrology, from all these different places, and they have a hospitalist. You have 4 or more doctors working on the same patient, caring for the same patient, and so that's obviously going to cause some people to maybe not agree with everything that a certain doctor is saying. So there's another example of intergroup. And then family members and floor staff. So family members, and along with the patient, they can often make it hard on nurses and other staff to complete their duties to the best of their ability. Maybe they think that they're not being cared for, their mom or dad isn't being cared for. Can you think of an example of a time where maybe you were at the hospital and your loved one wasn't cared for the way that you thought that they should be? And so now that could be definitely due because that's the reason, but it's still the conflict that presents itself. So there, believe it or not, are positive effects of conflict. When it is handled appropriately, it can actually lead to growth. Another thing by Mazda grad and Marjorie Baughman was that high quality conflict management and an optimum quality level brings employees closer together, develops a strong team spirit, creates a healthy competition environment, enhances employee motivation, stimulates innovative thinking, generates creativity, and creates a challenging and problem-solving atmosphere. So they did a study about how conflict arises, how conflict is best dealt with. They also did a study on the effects of conflict, and they found all of these things to be true with conflict. They found scenarios where a certain type of conflict could lead to growth, could lead to a healthy competition environment, or could lead to enhancing your problem-solving ability as a team. And conflict can definitely do that. So it creates obstacles. It definitely creates obstacles. But if you work as a team effectively to get over those obstacles, it can be very beneficial for you as a team. So there are negative conflict or effects of conflict. Unresolved or repressed conflict can be very damaging to a hospital or to an organization. If it's not dealt with, the problem could just keep escalating and escalating until it gets so out of proportion and so out of control that scenario can no longer be handled in an effective manner. And maybe things start to get ugly. Things may start to get hostile or something of that nature. So obviously there can be too much and poorly managed conflict. It is, like I said, damaging to an organization. It can create a hostile work environment, which can lead to employees having feelings of depression. It can leave them not wanting to come to work, not wanting to do their job like they're supposed to. So it just leads to many negative effects of staff. And then also too little conflict. If your organization isn't facing enough conflict, or you don't have a lot of conflict at work. Say you work with same people that are your age, your culture, the same people who share your same values. You might not have a lot of conflict, but you're also lacking the ability to grow in some instances because you don't have the same obstacles that some people do have, and therefore you're just not going to see those benefits that other people are seeing who are helpfully managing their conflict and have just the right amount. So some of the effects continue. It is the job of upper management to be aware of, one, the conflict that's going on under them and in their organization. And they should be aware of the effects that it can have. They should be aware of both the positive and negative. So, but first you have to be aware of the actual conflicts. And then to obtain the full benefit, they should focus on their own skills, how they do during conflict. They should evaluate themselves. Maybe they should ask their staff questions on improvement. Maybe they feel that they don't handle certain situations of conflict very well. So it is very important for a manager, supervisor, or administrator to evaluate their skill set in terms of conflict management and effective communication. So effective communication is definitely a necessity during conflict, and unfortunately, it is a skill that many managers and supervisors, administrators lack. It's a skill that many people lack, but with a job, being in a position where communication is so important, is very lacking in some of these managers and supervisors and things. So, and then the lack of it can be the link to the causes of many conflicts and can really just be detrimental to the effect. If you're not dealing with that conflict appropriately, then you're not, reaping the full benefit of the conflict that you could be. So what is effective communication during conflict? So business jargons defines effective communication as clear and concise information that is successfully delivered, received, and understood. So many people think that communication is just talking, and they think that it's just about you talking and another person talking. However, there's so many different aspects of communication that some people don't think about. One is creating a safe environment. How many people think about is just the first thing that comes to their head is creating a safe environment when thinking about effective communication? However, it is one of the most important things, because if there's not a safe environment, then how can you expect anybody to truly talk to you about the real issues that's going on at work? And then high quality listening. This is perhaps one of the most important aspects of effective communication, because you cannot fully talk with somebody and effectively talk with somebody without truly understanding what they're saying. And we often struggle with that. We often lack the hearing ability, and that is the listening ability that is a necessity to communicate effectively. And then correct body language. We saw in the video, the lady was rolling her eyes, she was throwing her hands up in the air, so was the other nurse. She was doing the same thing. And their body language, it matched their emotion, but that's not always a good thing. And then the right words for the right audience. Sometimes, you're not gonna be able to communicate with everybody the same way. You're just not. So you have to evaluate your audience. You have to evaluate the different cultures, the different social classes, even the different ethnicities, nationalities. You just have to think about everything before you go into the conversation or into the conflict itself. And then empathizing whenever possible. This is also something that has to be done, especially during conflict, because until you put yourself into someone else's shoes, you don't really see why they did what they did. And before you can do that, before you can get on to somebody, you really have to know the entire situation and to see what they went through to get to that end result. So lacking effective communication, we're talking about managers, administrators, and supervisors lacking effective communication, and a big part of it is due to improper education, also a lack of empathy and a power distance. So with education, a large portion of healthcare supervisors and healthcare management get their jobs through either experience or clinical skill, and it's not so much that they possess the qualities that they need to be successful. It's just they've shown that they're successful in the clinical setting. So the thought is maybe they'll probably be successful in management, or if they've been there for 15 years and they've exemplified showing a good job, doing a good job, they're suited. They're suited for that job. Is the thought process. But really, this just leads to on-the-job training, and you really don't get any other leadership education. You don't. All you have to go off of is their training, and if you're not adequately taking courses or getting the education required and furthering your education, then you're really just lacking potential. And then a lack of empathy. So I try to challenge everybody to walk a mile in somebody else's shoes, especially when it comes to conflict. So the problem with this is some managers, they'll congratulate somebody or they'll reprimand somebody just solely because the outcome of the situation was either beneficial or negative, but they don't really know what went through to come out of that, to get that end result. Maybe it was actually pretty easy for that person to have a positive outcome, and it wasn't a whole lot of struggle to get to it, but you're singing their praises. Or if you're reprimanding somebody because of a negative outcome, and you don't realize what they went through to get there, it could have been, their decisions really might have not been that bad when you get down to it. So that's another reason another way that effective communication is lacking. And there's a power distance. Management, they're in a position of power. They're in a position of, I'm over you, so to speak. They have subordinates. So it can be a deterrent. It can be a way of staff not wanting to talk to their manager because maybe they don't feel safe around them. Maybe they feel like if they say something that they shouldn't say, they may get fired or they may get in trouble, or somebody else might get in trouble. So that comes into play the importance of safe environment. And then you also have your cultural differences. This can relate back to right conversation, the right words to say at the right time or with the right audience. And so hospitals are more diverse than ever. Can you remember the last time that you were in a hospital? Think about all the different ethnicities, all the different nationalities of doctors, of nurses, of patients. There's a plethora of nationalities and race and ethnicities in the hospital. And so if you're not familiar with the different cultures that are within a hospital, then how can you expect to be able to, one, effectively communicate with these people, and two, deal with conflict with these people? So acknowledging the different cultures and really knowing how to talk with them is a very big step that needs to take place in order to communicate effectively. However, it doesn't really happen that often, or at least it's lacking somewhat. And then how can we develop our effective communication? How can you, if you feel like you want to do a better job, which I hope you do after this presentation, I hope you want to do a better job at communicating effectively. You can do it through education. So like we said, many management in healthcare doesn't go through further education to get into their leadership roles. So administration, management, or business degrees will help you, gain, it'll get you a degree, which, will benefit you in the long run, but it really focuses, each of these type of degrees focuses on communication skills and conflict management. So, and then on-the-job training, opposed to further education, it limits the exposure to certain ideas, to certain proven things that have worked, and it just limits your potential. It keeps you from being the best that you truly can be, because you're just stuck with those ideas and those practices that your boss or that the person who trained you, you're just stuck with those same ideas. And really, if you're not implementing new ideas, if you're not thinking of different ways to manage or to deal with your employees in the office, then you're not really going to change a whole lot, which is important. So according to Overton and Lowry, studies have shown that education and communication during conflict improved a person's ability to handle conflict by around 10%. So that's a pretty large percentage, in my opinion. So when they did their study, they found that just education and communication, that's it, just education. No other, just simply education improved it by 10%. So that's pretty impressive. And then training. Many hospitals often require leadership training for managerial positions. I know two of you have worked in a hospital setting, and I'm sure that they've required you to do some managerial training or some just classes that deal with management of some sort. So Leonard, Graham, and Bonham implemented training courses that are required by all aviation professionals, known as crew resource management. They implemented this process or these courses into a hospital, and they found really that it had the same benefit as it had in aviation, because that's what the CRM is from, and we'll get into it a little bit on the next slide. So what the CRM model, or what they implemented into the other hospital that they were at, some of the helpful tools and concepts that they taught were situational briefing, appropriate assertion, critical language, and the awareness and education regarding the fact that nurses, physicians, and other clinicians are taught to communicate in very different styles. So with situational briefings, they would just create situations for nurses and other staff that represented conflict or things that would come about, or there's a high chance of meeting that scenario in the hospital and how to deal with it. And then appropriate assertion deals with not really don't repress conflict, and don't avoid it. You want to be assertive. You want to approach that person, and just don't be passive about it. And then critical language deals with the fact that you want to create that safe environment. And how they recommend you do that is by using your critical language to tear down the hierarchy that you may or may not have created as a manager or in a managerial position, so that that employee or patient feels comfortable talking with you. And that's a really big aspect to get the truth from your employees. And then, doctors and nurses, they're trained to talk differently. Traditionally, nurses are taught to be more broad in their description of patients and other aspects of patients. And physicians, on the other hand, are taught to be much more specific. And so the two clash, because here's your two opposing forces. And so they really tackle that about how they're educated on speaking. This course really tackles and brings nursing and doctor communication closer together. And then so this is a cycle. This is the assertion cycle from Leonard, Graham, and Bonham. And so the first thing they say to do is to get the person's attention. You have to get that person's attention. You want their full, undivided attention, so that that they're receiving the things that you're talking about. And then you want to express that concern. You want to be sincere. You want to show them that what's going on is important. You just want to stress the importance of this situation. And then the problem. You want to state the problem. You don't want to be very indirect in this scenario or in this portion of the cycle, because in order for the person to fully understand the weight of this conflict, they need to really understand the whole problem and everything about it. And then you should propose action as to what to do about the problem. You want to focus on the problem. You don't want to focus on who is right, who is wrong, but you want to focus on the issue at hand and propose an action to deal with it. And then, once you do that, you converse and you reach a decision with either your employee or patient or whatnot, and you just collectively and together reach a decision that you can both agree on. And then the cycle restarts if another issue is brought up in the same conversation or with a new conflict. So that's the assertion cycle. And then how does effective communication affect conflict? So it creates a safe environment, like we talked about, with the critical language. It tears down that hierarchy, and it just helps patients, employees be in an environment where they feel safe and comfortable. And the more comfortable they feel, the more truth you'll get out of it. And as far as confusion, it takes confusion out of the scenario. If you're communicating effectively, you're saying the things that just aren't confusing. They don't mix emotions. Your body language fits what you're talking about. You don't start off the conversation with being friendly and end it by firing somebody or something like that. If there's any confusion in the air, which confusion can easily cause conflict, it sorts it out. It gets rid of it. And it shows you're genuinely concerned about the situation. You want to, again, show empathy. By showing empathy as a form and using it in your effective communication, it shows that that you care about the situation, you care about that person, and you want the best to come out of the situation and for the people involved. And then it helps prevent escalation. This can be seen as sorting out confusion. But what effective communication does, as we can see, in the video before, they were not communicating effectively, and this caused escalated emotions and feelings, and to start being argumentative. And what effective communication does, it takes that out of the equation for the most part. And sometimes you cannot escape escalation. Sometimes it can just happen, but it gives you the best fighting chance to prevent it. And then it gets everybody on the same page. It clears that confusion. And really, effective communication it lets you just reap the full benefit of conflict. So some of the personal examples of conflict that I've seen throughout my work experiences or in school were the perception of job requirements between RTs and nurses in a procedure lab, lackadaisical work ethic. You've got conflict during CPR. I've seen conflict during CPR and during other codes. During heart caths, endovascular procedures, and OR procedures, whether it be between doctors and scrub techs, doctors and technologists, or doctors and nurses, or whatever the situation may be. I've seen it in all three of those scenarios. And then I've seen it between cultural differences between employees, and I've seen it between recovery units and in our procedural labs. So a few examples on how to deal with that, or at least on how to have a little bit of effective communication, just to show you to use kind of the things we've talked about into some examples. The first one is, while assisting in CPR, you notice the person giving compressions isn't allowing for proper recoil of the chest. All other aspects of compressions are ideal, okay? So what I say is, Matt, you're doing good, but allow for more recoil of the chest. What's that do? Well, if we go back to our cycle, Matt, we got his attention. Express concern. I expressed concern, stated the problem, proposed an action, and reached a decision. We did 4 steps, and we did 4 steps, and not even about 10 words. And so, what did we talk about effective communication was? Is clear, concise communication and information that's effectively received, delivered, and understood. So what Matt understands is, my concern is the patient isn't getting good CPR. You're not allowing for more recoil. And so once I state the concern, or express the concern, there's the problem, which is there's obviously not enough recoil. So how do you fix it? Well, you allow for more recoil. And then I think that we could both agree, me and Matt, that this would be needed for CPR if we have the appropriate training. All right, so situation number 2. The technologist, Christy, and a nurse, Nikki, are in disagreement of whose job it is to stock certain items in the procedure lab. Both feel it is the other person's responsibility. You asked to speak with them privately in your office. So thank you both for coming and talking with me. I've noticed, there you see that's you're addressing them. I've noticed disagreement between responsibilities in the lab. I know it can be difficult to separate our responsibilities from working so close together. I also understand your opinions. So there's my concern, that's me expressing my concern. And then, however, these responsibilities apply to both positions. We rely on teamwork to efficiently and effectively complete our procedures, and this applies to stocking as well. So, I've really expressed my concern and the problem all in one, sort of, and then here's here's my proposed action. We rely on teamwork, and then hopefully from now on, if either of you notice low supply, I ask that you start together. So that's my proposed action. And are there any questions? And so once I ask that leaves room for discussing about discussing the final result, or the result that we come to, the reaching of a decision. And then situation number 3. The vascular team is performing a complex lower leg intervention. After spending an hour to pass a wire through an occluded artery, the doctor says, "Take it out," referring to the catheter, but the technologist, Misty, pulls the wire instead. The doctor, Dr. Smith, is infuriated. He yells at the technologist and makes derogatory remarks towards them. You need to address both doctor and technologist and speak with them individually. Dr. Smith, there's your address. I understand your frustration and the weight of an event like this carries. However, it is not acceptable to degrade staff, and I believe this situation could have been avoided with proper communication. If an event like this occurs in the future, control your emotions the best you can and use it as an opportunity to teach. So I've still kind of followed the same, cycle and everything. And then in response number 2, Misty, I'm sorry Dr. Smith acted poorly upon his emotions, and I know this mistake was not on purpose. However, this event could have been avoided with proper communication and being attentive. I cannot stress enough how important it is to be mentally involved in each case. If there is ever a question about what the doctor is asking, clarify before taking action. Is there anything about the situation you would like to further discuss? So, those are just scenarios that I feel exemplify effective communication pretty well. And then, so in my conclusion, I want to just stress that conflict can have positive outcomes if it is dealt with appropriately. And then too much or not enough can be detrimental to an organization. You need to evaluate your organization's conflict, the amount of it, how it's being dealt with. And then effective communication is a necessity. It is vital to the success of anybody's company, but during conflict, it is one of the key things to possess. Exercises, education, and training can help you improve your communication skills and conflict management. We talked about the CRM courses. We talked about furthering your education. We talked about training courses that most hospitals supply, or at least that they offer to their managerial position employees. And then attention, concern, problem, proposed action, and final decision. So remember, that was the assertion cycle. And that was one of the things that helps us kind of model how we deal with that conflict. So that's all I've got. I hope that you have enjoyed this presentation, and I appreciate your diligence to be here. And I want to introduce everybody. Is that what my mom, my dad, my mother-in-law, and my wife.